Welcome to Flash News.
Long COVID-19, I'm physically and mentally not able to do anything. One Christmas, Michelle Kibble was given a mug with Chaos Coordinator printed on the side because she was so busy juggling her full-time job in a pharmacy with being the main carer for her bedbound father and running a small business with her husband of 25 years, Terry. But Michelle and Terry's lives changed forever when Michelle, 47, from Swindon, almost died after contracting COVID-19. It left her disabled, she lost her job, and became fearful of leaving the house in case she caught the virus again. In her own words, Michelle tells the BBC how the trauma has affected her family and how she is managing to cope. "I had a really bad headache for about 3 or 4 days in November 2020. It got to the stage where the pain was so severe I used to bang my head against the wall. My husband could hear me and he called 111. The paramedics came and apparently the oxygen levels in my body had dropped considerably, so they took me to hospital. They did a COVID test and we were both positive. My husband did get ill but with mild symptoms. I ended up in intensive care and just went downhill. I was put into a coma and on life support. They phoned my husband regularly, but one day they called him and said, 'Look, you need to make everybody aware and prepare for the worst as she's not going to make it to the morning.' The doctors said I only had about a 12% chance of survival and they didn't know if I did wake up whether or not I would be brain dead because apparently I had lack of oxygen go to my brain. I don't remember any of it, but I can't even begin to imagine what my husband went through. I was discharged from hospital in January 2021. When I first came out, Terry would break down. He was just so completely devastated. When you think you're going to lose that person, you will never see them again. It just changes your whole life. Just as we came home and were trying to get our life on track, they confirmed I had lung disease and it's never going to get any better. I have had MRI scans and tests and have been referred to the memory clinic. I had memory problems before COVID, but now they are severe. I am physically and mentally not able to do anything. I don't go out. I can barely walk far without getting really out of breath. My husband sometimes has to even carry me upstairs to bed if I can't make it up the stairs by myself. Being so motivated and so full on and physical and then all of a sudden you can't do things anymore is hard. I think there's a lot of people out there that don't understand. If I say I'm breathless or I get tired easily, they'll just say, "Oh, pull yourself together," but it's so much more than that. It's life-changing. I used to work full-time as a pharmacy dispenser for 12 years, Monday to Friday and Saturdays, but I have now lost my job. I also looked after my dad as his full-time carer. Financially it's been really hard. We've had to cut our cloth accordingly. I do get a small amount from disability allowance, but it's only the basic, but then every little bit helps. The main thing I miss the most is independence. I think when you're not earning you feel maybe I shouldn't buy that because I've not earned the money. I do feel guilty. I very rarely have contact with people. I haven't seen my dad since I caught COVID. I'm not sure where I caught the virus from. It may have been at my dad's, possibly from one of his carers, and that's why I'm cautious of going there. So it has been hard not to be able to see him, but I have to protect myself. I've always put myself last, but I have to put myself first for a change. I know it's really silly, but I'm really cautious about everything I do. Because it's had such a major impact on our life and the trauma that it caused, I just don't want to take that risk anymore. I want to be safe in my home. I don't go out socializing. I've not been in touch with my friends. With the lung disease, I have to have lung function tests and I am due to have breathing tests. I will be constantly on medication and I also have a thyroid problem since having COVID. But apart from that, it's just pain management really. I'm hoping to get in the right frame of mind to not be so worried when I do go out. There's still loads of things we want to do. We're not old yet. I think moving forward, if they can get my breathing under control and the medication does its thing, then I can try to get out a bit more. I want to live a life as normal as I can with my husband and my family. To keep going is the only thing I can do. COVID-19, an end to 2 years of statistics and BBC whiteboards. What has been a daily COVID marker for more than 2 years has come to an end. Am I sad? Absolutely not. However, it is a significant moment in Northern Ireland's COVID-19 story. For more than 2 years, the Department of Health published the COVID-19 daily dashboard statistics online. That ended on Friday when the final post said there were 262 positive cases reported in the past 24 hours and no deaths have been reported in that period. But while publishing the data has ceased, COVID has not. Over the past 2 years, my colleagues and I in the BBC NI Health Hub transferred the daily data onto huge whiteboards that consumed our office. In March 2020, we thought one board would suffice. By May 2022, we had used up 4 large boards all filled with numbers both back and front. Every single number represented a person, a man, or a woman who each had a story. At the beginning, families told us that they did not want their loved ones remembered as just a statistic. My colleague, Catherine Smith, and I took turns filling in the board. At first the writing was neat and orderly, but our patience dwindled. I recall one of us saying, "This will probably last around 3 months." In those early days, we often knew the person behind the number, but then the numbers exploded and we just couldn't keep up. As days unfolded into weeks and months, it became impossible to put a name and face to every statistic. From a WhatsApp conversation in her living room, and just hours after receiving the call from the hospital that her mum had died, Brenda told me her mum would not be hidden behind a number and instead she asked us to publish photographs. Many others did the same. The Daily Bulletin gave the number of deaths, inpatients, cases, care home outbreaks, hospital bed occupancy and other general notes. For some, it became the COVID Bible, for others the statistics just added to the COVID myths and misconceptions. Back in March 2020, when our world changed, the figures were tweeted by the Department of Health each day at 1400 hours BST. The peak was early March, after the school half-term and a popular holiday time for families. As we learned over the 2 years, travel meant the virus spread and the numbers increased. Over time, a pattern emerged. Holiday periods triggered a rise in numbers and our boards would look busier. Our whiteboard markers were replaced 3 times. By May 2020, like the virus, IT systems had advanced and the COVID daily dashboard went online. For journalists, the 1400 hours COVID alert provided vital information which would determine how our lives would roll for the following weeks and months. We were advised by several number nerds on Twitter and while we stuck to our whiteboards, they studied spreadsheets. I recall one particular night in February 2021. The executive was preparing a pathway to recovery roadmap. We reported the rolling 7-day average for deaths in Northern Ireland stood at 6 expected deaths per day. While that wasn't the worst, the enormity of the past year finally hit me. Surrounded by the whiteboards, I realized this COVID emergency was far from over. I have been asked why whiteboards and not spreadsheets. Seeing and physically writing those numbers in red, green, and black each day was more tangible, less technical. By writing the numbers, often with others looking on, it triggered conversations. It was almost therapeutic. Program producers and presenters gathered in front of the boards and discussed the numbers before programs. They are a physical chart of a time most of us would choose to forget, but know for various reasons they cannot be erased. I cannot wipe them. The whiteboards preserve a real-time image of the pandemic as it unfolded over 2 years. As someone tweeted, they are a work of art, remembering the people behind the stats. Could they be part of a Northern Ireland pandemic memorial? I hope so. I cannot wipe them, that would be like erasing time. Pfizer says 3 doses of its vaccine produce a strong response in young children. Preliminary results appeared to show that 3 doses of the coronavirus vaccine worked better than 2, but the company did not release supporting data. Washington, Pfizer and BioNTech said on Monday that preliminary findings from a clinical trial of children younger than 5 showed that 3 doses of their coronavirus vaccine produced a strong enough immune response to meet the criteria for regulatory authorization. In a news release, the companies said the 3-dose regimen had been 80% effective in preventing symptomatic infection in a subset of the 1,678 trial participants, who were 6 months through 4 years old. A spokeswoman for Pfizer said comprehensive results from the trial would be disclosed next month. About 18 million children under the age of 5 are the only Americans not yet eligible for vaccination against the coronavirus, and both Pfizer and Moderna are hoping to soon win authorization to vaccinate them. but parents' hopes for a time and date when shots will be offered have been repeatedly dashed. Pfizer and its partner, BioNTech, said the number of children in the trial who fell ill with COVID-19 was too small to make a definitive statement on efficacy. Only 10 participants became ill with COVID after those in the vaccination group were given the third dose. The clinical trials protocol specified that analysis of vaccine efficacy required at least 21 COVID cases. The companies said that final data on efficacy, a secondary endpoint for the clinical trial, would be shared once available. The Biden administration had hoped to offer vaccine doses to those under 5 as early as February. The Food and Drug Administration initially pressed Pfizer to submit data on how well 2 doses worked for young children, but pulled back after Pfizer said 2 doses were not sufficiently effective in preventing symptomatic infection from the highly contagious Omicron variant. The company then began focusing on a 3-dose regimen. In late April, Moderna sought emergency authorization of its pediatric vaccine after interim results showed that clinical trial participants had a similar immune response to young adults when given a dose 1/4 as strong. It was expected to finish submitting its data to the FDA this month. Moderna initially hoped regulators would put its data before the F.D.A.S. expert committee of outside advisors on June 7. But federal officials have said they would consider a brief delay in reviewing Moderna's application if it meant they could evaluate Pfizer's at the same time. The FDA announced Monday that the committee would consider both Pfizer's application for a 3-dose regimen and Moderna's application for a 2-dose regimen on June 15. The delays have deeply frustrated many parents of young children, who complain that the rest of the nation has moved on from the pandemic while they continue to limit play dates, travel, dining out, trips to grocery stores and more. Of the nearly 500 parents who answered a reader call-out from the New York Times on Monday, many complained that the FDA and Centers for Disease Control and Prevention were moving too slowly to get initial shots to the youngest group, while older Americans bolster their protection with booster shots. The respondents are not considered representative of the U.S. population. I understand they want all the data, but we know that the vaccine has been extremely effective at preventing severe disease in all age groups and is very safe, said Dr. Tress Goodwin, who practices emergency pediatric medicine and is a mother to 3-year-old twins in Washington, D.C. It's crazy to think that my kids won't be vaccinated until more than a year and a half after I got vaccinated myself. It has been demoralizing when that goalpost keeps getting pushed further and further down the line, she added. Cheryl Hillis of High Point, NC, was so concerned about protecting her 3-year-old daughter that she enrolled her in a Pfizer trial in Atlanta and made the long road trip to that city twice. She will hit the road a 3rd time at the end of the week, for the final dose. Ms. Hillis has been homeschooling her 3 other children, ages 9, 11, and 14, until her youngest gets vaccinated. Like some other parents who answered the newspaper's call-out, she does not expect a pediatric vaccine to protect against infection as well as the adult vaccines did when they were first authorized, before an onslaught of variants cut their potency. At this point, she said, many parents are mainly interested in staving off long COVID, hospitalizations, and deaths among the youngest demographic. We have almost no options to keep our children safe, save isolation, she said in an interview. Pfizer said that its new results showed that 3 doses, with the 3rd given at least 2 months after the 2nd, stimulated the immune system to strongly protect against the virus, with no safety concerns. Researchers said the immune response of the subset of trial participants, measured 1 month after the 3rd dose, compared favorably to that of people 16 to 25 who received 2 doses. No supporting data was disclosed, nor was the number of children in the subset. We are pleased that our formulation for the youngest children, which we carefully selected to be 1/10 of the dose strength for adults, was well tolerated and produced a strong immune response, Dr. Albert Bourla, Pfizer's chief executive, said in a statement. Dr. Ugur Sahin, chief executive of BioNTech, said the companies would complete their FDA application for emergency authorization of the pediatric vaccine this week. With Pfizer and Moderna proposing different dosing regimens and delivering different results, the question of which vaccine works better will be central for the FDA. But the agency's regulators and their outside advisors are expected to independently evaluate each vaccine to see if it meets the requirements for emergency authorization. On June 14, the advisory committee will also discuss the Moderna vaccine for children and adolescents from 6 to 17 years. Moderna is proposing a 2-dose regimen for children younger than 6, using a dose 1/4 the strength of its adult dose. The company has said it anticipates that a third dose will be necessary as a booster shot, but it has not yet submitted any data on that to the government. Moderna said in late April that its interim results showed that clinical trial participants had an immune response similar to that of young adults when given the quarter dose. Like Pfizer, the firm said its results met the clinical trial's criteria for success. Moderna said its vaccine appeared to be 51% effective against symptomatic infection among children younger than 2, and 37% effective among those 2 to 5. If Pfizer's results are borne out by subsequent data, its efficacy would be better than Moderna's. Both companies say their vaccines produce similar side effects to other pediatric vaccines that have been used for decades. At this point, Aaron C. Hall, the father of a young child in Murfreesboro, Tennessee, said he would accept any efficacy rate above 0. It has been very frustrating to essentially remain in semi-quarantine while the rest of the world has moved on, he wrote. COVID-19 update: 15 further deaths and 8,435 new community cases. Today the country has experienced another 15 deaths of people with COVID-19 and 8,435 new community cases, the Ministry of Health says. There are also 327 in hospital with the coronavirus, including 10 in intensive care. That compares with 363 people in hospital with the virus, including 14 in intensive care yesterday. In its latest media update, the ministry said the 7-day rolling average of community case numbers is 7,507. Last Tuesday it was 7,795. Of the deaths reported today, 3 were from the Auckland region, 1 was from Waikato, 1 was from Taranaki, 2 were from the Wellington region, 1 was from Nelson Marlborough, 4 were from Canterbury and 3 were from Southern. 1 person was in their 40s, 2 were in their 60s, 1 was in their 70s, 3 were in their 80s and 8 were aged over 90. Of these people, 9 were female and 6 was male, the ministry said. This is a very sad time for Whole Na and friends, and our thoughts and condolences are with them. The new community cases being reported today were in Northland, 270, Auckland, 2,807, Waikato, 635, Bay of Plenty, 274, Lakes, 149, Hawke's Bay, 268, Mid-Central, 257, Whanganui, 93, Taranaki, 252, Tarwaiti, 59, Wairarapa, 85, Capital and Coast, 609, Hutt Valley, 217, Nelson Marlborough, 326, Canterbury, 1,255, South Canterbury, 139, Southern, 659. West Coast, 79, and the location of 2 were unknown. COVID-19 news: England and Wales Omicron death toll similar to flu. Latest coronavirus news as of 2 p.m. May 24. During the recent surge of the milder Omicron variant in England and Wales, COVID-19 caused a similar number of deaths as flu and pneumonia in the years before the pandemic emerged. COVID-19 caused a similar number of deaths in England and Wales over the past winter as flu and pneumonia in previous years, according to an analysis by the Office for National Statistics, ONS. In January 2022, for instance, COVID-19 was the underlying cause of 4,100 deaths, while flu and pneumonia caused an average of 4,328 deaths every January from 2016 to 2020, before the pandemic took hold. In the latest winter, the number of deaths with COVID-19 as the underlying cause has fallen more in line with those due to flu and pneumonia in pre-coronavirus pandemic years, says the ONS report. Flu and pneumonia deaths are generally classed together as flu often causes lung damage that leads to bacterial pneumonia. In the past 2 years, flu and pneumonia caused far fewer deaths than normal, probably because of lockdowns and less social mixing between lockdowns, says the ONS. Flu is less easily passed on than the coronavirus, so social distancing reduced flu transmission even while COVID-19 was spreading fast. Before the recent Omicron surge, COVID-19 caused more deaths than flu and pneumonia. COVID-19 was the leading cause of death in England and Wales in 2020, and provisional figures suggest that will also be the case in 2021. One difference between COVID-19 and flu is that a higher proportion of COVID-19 deaths affect middle-aged people. In the first 2 years of the pandemic, about 1 in 12 COVID-19 deaths were in those aged under 60, compared with 1 in 20 deaths from flu and pneumonia. That COVID-19 deaths were both greater in number and affected a broader range of ages highlights just how much more lethal COVID had been, Roland Cow at the University of Edinburgh said in a statement to the Science Media Centre. It is, however, difficult to tell what this means for the future. The absence of physical distancing measures and the likely reduction in COVID-19 vaccine booster coverage, and likely lower flu vaccine coverage, will mean that future mortality is difficult to predict. Other coronavirus news: being vaccinated against COVID-19 does reduce the severity of infection in people with cancer or a past cancer diagnosis, despite their immune systems being weakened from their disease or treatments, an analysis has found. People with cancer do experience a faster waning of immunity within 3 to 6 months, however, showing how important it is for them to get booster jabs, say the researchers, who looked at a cancer registry from England. More than half of people admitted to hospital with COVID-19 have probable heart inflammation, known medically as myocarditis, 2 months after being discharged, a study has found. What to read, watch, and listen to about coronavirus. New Scientist Weekly features updates and analysis on the latest developments in the COVID-19 pandemic. Our podcast sees expert journalists from the magazine discuss the biggest science stories to hit the headlines each week, from technology and space, to health and the environment. The Jump is a BBC Radio 4 series exploring how viruses can cross from animals into humans to cause pandemics. The first episode examines the origins of the COVID-19 pandemic. Why is COVID killing people of color? Is a BBC documentary, which investigates what the high COVID-19 death rates in ethnic minority patients reveal about health inequality in the UK. Panorama, The Race for a Vaccine is a BBC documentary about the inside story of the development of the Oxford/AstraZeneca vaccine against COVID-19. Race Against the Virus, Hunt for a Vaccine is a Channel 4 documentary which tells the story of the coronavirus pandemic through the eyes of the scientists on the front line. Race Against the Virus, Hunt for a Vaccine is a Channel 4 documentary which tells the story of the coronavirus pandemic through the eyes of the scientists on the front line. The New York Times is assessing the progress in development of potential drug treatments for COVID-19, and ranking them for effectiveness and safety. Humans of COVID-19 is a project highlighting the experiences of key workers on the front line in the fight against coronavirus in the UK, through social media. Belly Mujinga, Searching for the Truth is a BBC Panorama investigation of the death of transport worker Belly Mujinga from COVID-19, following reports she had been coughed and spat on by a customer at London's Victoria Station. Coronavirus, Explained on Netflix is a short documentary series examining the coronavirus pandemic, the efforts to fight it and ways to manage its mental health toll. Stopping the Next Pandemic, How COVID-19 Can Help Us Save Humanity by Deborah Mackenzie is about how the pandemic happened and why it will happen again if we don't do things differently in future. The Rules of Contagion is about the new science of contagion and the surprising ways it shapes our lives and behavior. The author, Adam Kucharski, is an epidemiologist at the London School of Hygiene and Tropical Medicine, UK, and in the book he examines how diseases spread and why they stop. The UK Vaccine Advisory Group has recommended that over 65s, people in care homes, frontline health and social care workers, and clinically vulnerable people aged 16 to 64 be offered a booster jab this autumn. Last year's autumn booster vaccination program provided excellent protection against severe COVID-19, including against the Omicron variant, Wei Shenlim at the Joint Committee on Vaccination and Immunization said in a statement. Adding the recommendation will allow the NHS and care homes to start the necessary operational planning to deliver the jabs. Across the UK, a spring booster is already available to over 75s, care home residents and people aged 12 and over with suppressed immune systems. The Scottish, English and Welsh governments have confirmed they will follow this advice, while Northern Ireland is yet to announce its plans, according to a BBC report. Other coronavirus news: COVID-19 was the third leading cause of death in England in April, accounting for 6.1% of all fatalities, according to the Office for National Statistics. 1 month earlier, COVID-19 was the sixth leading cause of death. As of May 19, North Korea had reported 2.24 million cases of fever since late April. Officials have not specified this as due to COVID-19, however, fever is a key symptom of the infection. The country imposed a national lockdown earlier this month after reporting its first COVID-19 case on May 12. COVID-19 testing is limited and there is no official record of any of North Korea's 25 million-strong population being vaccinated. An economic downturn and lack of reforms has left the world in no better position to fight a new pandemic than before COVID-19 emerged, according to the World Health Organization, WHO. The world's pandemic preparedness is the same or worse than it was before COVID-19, according to a WHO report. The report, led by former New Zealand Prime Minister Helen Clark and former Liberia President Ellen Johnson Sirleaf, accepted that some progress had been made, like moves to create a global health security fund inside the WHO and increased WHO funding. But progress on reforms such as international health regulations are moving too slowly, it added. We have right now the very same tools and the same system that existed in December 2019 to respond to a pandemic threat, Clark said at a press conference. And those tools just weren't good enough. The report also suggests some measures that should be taken as soon as possible, including an independent health threats council led by heads of state, a worldwide pandemic treaty and an international agreement to improve pandemic preparedness. The WHO's annual World Health Assembly will meet in Geneva next week to address issues raised in the report. Other coronavirus news: unvaccinated people who recover from the Omicron variant may not have immunity against other COVID-19 variants, such as Delta, according to mouse models in a small human study. Researchers at Gladstone Institutes in San Francisco, U.S., collected blood serum from mice 7 days after they were infected with different COVID-19 variants. In laboratory experiments, the serum collected after overcoming Omicron only protected against the Omicron variant. By contrast, the serum collected after infection with Delta effectively protected against the Alpha, Beta, and Delta variants, as well as offering some protection against Omicron. These findings were then supported in a study of 10 unvaccinated people who had recovered from Omicron. By contrast, vaccinated people who catch Omicron develop some level of immunity against all COVID-19 variants of concern, the researchers found in a separate experiment. North Korea has suggested people use traditional medicines, such as gargling salt water or drinking herbal tea, to reduce the fever and pain that can come with COVID-19. A state news agency said the unverified treatments are effective in prevention and cure of the malicious disease, a claim that is not supported by scientific research. May 16, 6 weeks into the vaccine rollout for this age group, fewer than 1 in 10 children aged 5 to 11 have received their first dose. The 7% figure compares with the 24% of 12 to 15-year-olds in England who received a first dose in the 6 weeks after they became eligible for the vaccine in September 2021. Children rarely become seriously ill with SARS-CoV-2 virus, however, testing positive can disrupt their schooling or put them. Children rarely become seriously ill with SARS-CoV-2 virus, however, testing positive can disrupt their schooling or put them at risk of long COVID. Speaking of 5 to 11-year-olds, Russell Viner at University College London told The Guardian, "It's a vaccination that probably isn't particularly beneficial for this age group. However, it has a very good safety profile. And given that we remain in a pandemic, there's an argument that for individual parents, the balance of risks would appear to be towards vaccination." Across England, Oxfordshire has the highest vaccine take-up among 5 to 11-year-olds at 12%, while Knowsley in Merseyside has the lowest uptake at 3%, according to the latest NHS statistics up to May 8. 2 COVID-19 vaccines are being offered to children from 5 years old across the UK. On March 15, 2022, Wales became the first UK nation to offer 5 to 11-year-olds a COVID-19 vaccine, with 9.5% of children in this age group receiving their first dose by May 4. In Scotland, 17% of 5 to 11-year-olds had received their first dose as of May 3. In Northern Ireland, just 2% of children in this age group had received their first vaccine dose as of May 5, according to National World. Getting vaccinated is a personal choice between families and their children, and we have now sent invites to everyone eligible, providing parents with information to allow them to make an informed decision, while they can also talk to their doctor or a local healthcare professional if they have questions, an NHS spokesperson said. Other coronavirus news: Shanghai will aim to return to normal life from June 1 after being in lockdown for more than 7 weeks. From June 1 to mid and late June, as long as risks of a rebound in infections are controlled, we will fully implement epidemic prevention and control, normal ease management, and fully restore normal production and life in the city, said its deputy mayor Zhong Ming. More than 1 million people in North Korea are suffering from what its state media is calling a fever, a key COVID-19 symptom. This comes less than 1 week after North Korea's leader Kim Jong-un confirmed the country's first COVID-19 cases and deaths. Of the 1 million fever cases, at least 187,000 people have been isolated and treated. It is unclear whether these cases have tested positive for SARS-CoV-2 virus. North Korea, which is in lockdown, is thought to have limited capacity for COVID-19 testing. There is also no official record of any of its 25 million strong population being vaccinated. Kim instead prioritized keeping COVID-19 out of the country via strict border controls. May 13, the US has officially passed the tragic milestone. However, many more deaths are expected to have occurred than have been recorded. The US has officially recorded more than 1 million COVID-19 deaths, President Joe Biden said on May 12, calling the fatalities a tragic milestone. 1 million COVID deaths, 1 million empty chairs around the family dinner table, each irreplaceable losses, said Biden. We must remain vigilant against this pandemic and do everything we can to save as many lives as possible, as we have with more testing, vaccines, and treatments than ever before. The scale of the death toll is far larger than originally anticipated, with Anthony Fauci at the U.S. National Institutes of Health saying in March 2020 that between 100,000 and 200,000 people could die from COVID-19. The U.S. has a higher official COVID-19 death toll than anywhere else in the world, but many fatalities are expected to go unrecorded in some countries. A recent World Health Organization, WHO, report looked at excess deaths, defined as the number of fatalities from any cause in 2020 and 2021 compared with previous years. This included COVID-19 deaths that were not recorded as such, as well as people who died from other causes because hospitals were full amid the pandemic. The report found that India had the highest number of overall excess deaths, while Peru and Russia had the highest number of excess deaths for their population size. Separately, 2 million COVID-19 deaths have been recorded across the European region, which includes the UK, the WHO said on May 12. Other coronavirus news: 6 COVID-19 deaths have been officially reported in North Korea, where the pandemic is spreading explosively, according to the country's state media. North Korea imposed a national lockdown on May 12, after acknowledging its first COVID-19 cases. Since late April, 350,000 people in North Korea have been treated for fever, but the country is thought to have little capacity for COVID-19 testing. It has not reported carrying out any COVID-19 vaccinations. Shanghai has said it is aiming to achieve 0 cases of COVID-19 outside of tightly regulated quarantine zones by mid-May. Cases outside the quarantine zones are an indicator of whether the outbreak is spreading. This comes after the WHO called China's zero-COVID policy unsustainable, because the Omicron variant is so transmissible.